Hello to all of you. The topic of the today is poliomyelitis. So, polio is a very familiar word because, as we all know, it generally affects the children of age group 5 to 15 years. So, let us study about the polio. It is a very communicable disease because it get easily spread by the droplets when you sneeze or any kind of the contact. So, it get easily spread. It is a type of a viral infection and caused by the enterovirus. So, how it get affects? So it affects the AHC, anterior horn cells and brainstem. Anterior horn cells of spinal cord and brainstem, and it produces flaccid motor paralysis. So where are the AHC located? AHC is located anteriorly portion of grey matter. जो हमारा ग्रे मैटर होता है, suppose this is the grey matter, so its anterior part, this part is anterior horn cells. So it generally affects this part. Now, what is the flaccid motor paralysis? Flaccid motor paralysis is a term that is used for the weakness of the lower motor neurons. Lower motor neurons weakness is termed as the flaccid motor paralysis, includes weakness of the respiratory muscles and pharyngeal muscles. Respiratory and pharyngeal. So it mainly affects the respiration system also. Or you may face difficulty in respiration while having this type of disease. So it primarily attacks and destroys the AHC. ये आपके AHC को primarily affect करेगा, destroy करेगा. And it is very much common in the children of age between 1 to 4 years. Very common. The incubation period is 4 to 14 days. It gets incubated in 4 to 14 days. Now let's come to the stages. Poliomyelitis has 3 stages. One is the acute stage of paralysis. Second is the recovery stage. And third is the residual paralysis. So when we will talk about the treatment or the rehab process of this, so that comes according to the following stages. Now let's talk about the poliomyelitis first. A type of poliomyelitis, paralytic poliomyelitis. This is a type of a paralytic poliomyelitis. Now let's elaborate this. It gets the involvement of the motor nerve cells of the spinal cord. जो हमारे spinal cord में motor nerve cells involved है, उस पे ये जाके इफेक्ट करेगा और ये रिजल्ट देगा हमारा एज पैरालिसिस or paralysis of various muscle. So it generally affects or involves the motor nerve cells of the spinal cord and result in the paralysis or paralysis of the various muscle. Now what is the paralysis? पैरालिसिस इज अ कंडीशन ऑफ अ मसल. ये एक मसल की कंडीशन है जिसमें उसकी वीकनेस इन्वॉल्व है. जनरली मसल वीक हो जाती है. दैट इज कॉज बाय द नर्व डैमेज और अ डिसीज, स्पेशली द पार्शियल पैरालिसिस. वीकनेस ऑफ मसल caused by nerve damage or any kind of a disease. स्पेशली इसमें पार्शियल पैरालिसिस इन्वॉल्व होता है. Now let's talk about the types of the paralytic poliomyelitis. This is of 4 types. The first type is spinal paralytic poliomyelitis. Spinal paralytic poliomyelitis. So when we talk about the spinal paralytic poliomyelitis, it generally involves the spinal cord and brain. In early stage, you may see the severe cramping of the muscles and hyperesthesia of overlying skin. सीवियर क्रैम्पिंग होगी इसमें अर्ली स्टेज में और हाइपरेस्थीसिया होगा. हाइपरेस्थीसिया मीन्स सेंसिटिविटी ऑफ द स्किन, फिजिकल सेंसिटिविटी ऑफ द स्किन जो बहुत ही ज़्यादा एक्सेसिव हो जाती है. नाउ इन द चिल्ड्रंस less than the age of 5 years, you may see paralysis of one leg. That is common. Between 5 to 15 years of the children, you may see the weakness of one arm. Weakness of one arm or lower extremities, both. So this is very common in the children between the age of 5 to 15 years. Now more than 16 years of age, involvement of respiratory muscles paralysis. So as you can see in the image, this is the spinal paralytic poliomyelitis. Now let's come to the second type, that is bulbar poliomyelitis. So bulbar poliomyelitis involves the damage of medulla, pons and midbrain. So there is the involvement of the medulla, pons and midbrain. You can see in the picture. Now it affects or it dysfunctions the cranial nerve nuclei. Dysfunction of the cranial nerve nuclei seen. Plus respiratory involvement plus vasomotor regulatory centers in medulla. So in the medulla, vasomotor regulatory centers are present. Let's talk about the vasomotor regulatory center. What's the function of this center? Temperature dysfunction. The temperature of the body get imbalanced due to the involvement of the gonadal hormones or due to the changes in the gonadal hormones. Temperature dysfunction due to changes in gonadal hormones. This is the function of the vasomotor. So in this picture you can see the bulbar poliomyelitis. Now let's talk about the third category, that is bulbospinal poliomyelitis. First we see the picture of this. So generally it is also known as respiratory poliomyelitis because the involvement of the respiration system is mostly affected in this bulbospinal poliomyelitis. It involves the symptoms of both spinal and bulbar. Generally affects the upper part of the spinal cord, that is mainly the C3 to C5 segments. It causes, guys focus on this statement, it causes the paralysis of diaphragm. Diaphragm is the main muscle, is the main area that helps the person for breathing. If this get paralyzed, your respiratory system get fails and you need ventilator support for the respiration. Diaphragm is get motor supply by the phrenic nerve, and due to this bulbospinal poliomyelitis, phrenic nerve get paralyzed, and hence it is get paralyzed, so it neglect or cuts the motor supply to the diaphragm, which is the main responsible for the respiratory system. Sometimes heart functions also involved or also affected. Now the fourth type is the polioencephalitis. So polioencephalitis, as you can see the itis stand for inflammation. So by this it gets very clear that there is the inflammation of the motor neuron within the brain stem. Inflammation of motor neuron within the brain stem, motor cortex, spinal cord. So firstly, it causes swelling and redness of gray matter. How does it affect? It causes the swelling and the redness of the gray matter. Then stiffness of back and neck muscles involved. Then muscle cramps occur, dysphagia happens, loss of reflex and headache. Dysphagia is difficulty in swallowing. So within the 10 days of the symptoms, paralysis occurs. Now assess the muscle that graded from 0 to 5. Then you have to assess all the muscle group, because tenderness is present. So tenderness, as soon as it allows you, on that basis you can assess the power of the muscles. Then जो भी आप मसल चार्टिंग करोगे वो आप पैरालिसिस जब आपकी स्टार्ट हो जाएगी, ऑनसेट ऑफ द पैरालिसिस पे करोगे. देन जब आपका रिकवरी पीरियड स्टार्ट होगा तो आप अपना जो मसल चार्ट करोगे वो आप रेगुलर इंटरवल्स पे करोगे. देन आपको ये याद रखना होगा कि जब आप असेसमेंट करोगे इनिशियल पावर की, 3 वीक्स में जब भी आप असेसमेंट करोगे इनिशियल पावर की, आप उसमें ऐड 2. For example, if the power of the muscle is 2, then it should be 4 at the time of the recovery. Or finally it gets 4. So this is the hack. Basically, when you're going to assess the muscle, assess the power of the muscle at 3 months. So you need to add 1. So after the 6 months, all the muscles get recovered is due to the hypertrophy, because there is a increase in the mass. So um, I'll explain you again. सो व्हेन वी डू द एग्जामिनेशन, पहले हम मसल चार्टिंग करेंगे जो कि हमारी ग्रेडेड होगी 0 to 5। फिर हम सारी मसल्स ग्रुप का जो भी इन्वॉल्व है उनका पावर को असेस करेंगे एज सुन एज टेंडरनेस अलाउज यू, बिकॉज व्हेन द टेंडरनेस इज प्रेजेंट and you're going to exceed the motion or exceed the motion of the muscle to get the more power, so it will be very painful for the patient. So in a limit range of motion आप अपनी मसल्स, आप जो भी मसल्स इन्वॉल्व है उनकी पावर को असेस करोगे। देन आप मसल चार्टिंग जब स्टार्ट करोगे, मेक श्योर दैट देयर विल बी द ऑनसेट ऑफ द पैरालिसिस। ऑन दैट ऑनसेट ऑफ द पैरालिसिस यू आर गोइंग टू चार्ट द मसल। देन when the recovery period start, make sure you chart the muscle on the regular intervals. At the 3 week, this is the hack for you, add 2. So at the final stage, if you add the 2, for example the power of the muscle is 2 एट द प्रेजेंट, सो ये आपके मन में और आपके दिमाग में रहेगा कि जब भी हम इसकी फाइनल स्टेज पे मसल चार्ट करेंगे तो इसकी पावर ये होनी चाहिए। उसी हिसाब से आप पेशेंट के अंदर जो भी ट्रीटमेंट हो रहा है उसके रिस्पॉन्सेस देखोगे और आप उससे एसेस कर पाओगे कि फाइनल स्टेज पे मसल चार्ट जो है इस मसल का वो 4 होनी चाहिए इसकी पावर। सो एट द 3 month you'll add 1 to it, and after the 6 month all the जो भी मसल की रिकवरी होगी वो रेजिडुअल मसल्स की जो भी रिकवरी होगी वो बिकॉज ऑफ द हाइपरट्रॉफी होगी, क्योंकि उसमें मसल मास इंक्रीज हो जाएगा। सो दिस इज़ द एग्जामिनेशन। नाउ देर आर सम डिफॉर्मिटीज इन्वॉल्व इन द पोलियो। सो जो आप लोअर लिम्ब पे डिफॉर्मिटी देखोगे वो आप देखोगे हिप और नी पे। व्हेन द पेशेंट इज सफ़र फ्रॉम द पोलियो, हिप पर फ्लेक्शन होगा, abduction होगा, एक्सटर्नल रोटेशन होगा, प्लस इन्वॉल्वमेंट ऑफ सबलक्सेशन। सो सी द इमेज, देर इज द फ्लेक्शन of the hip, focus on the hip joint, there is the flexion, abduction and the external rotation. So this is the deformity of the hip in the polio patient. Now let's come to the knee. On the knee you can see the genu recurvatum. This is the image of genu recurvatum. So on the knee there is the genu recurvatum, rotation of tibia and subluxation. So these are the deformity of the lower limb. Now let's come to the spinal deformity. Spinal deformity पे आप scoliosis देखोगे. Now in the spine you will see the scoliosis. Scoliosis is due to the imbalance of the lateral flexus. जो भी हमारे lateral flexus muscles हैं वो imbalance होंगे, weakness होगी, इसलिए आपका scoliosis होगा. Now in the ankle you will see many of the deformity like equinus, varus valgus, pes planus cavus. You can also see the pelvic tilt. Pelvic tilt is because of the limb length discrepancy. क्योंकि आपकी जो लिम्ब की लेंथ है दोनों में फ़र्क होगा, इसलिए आपकी पेल्विक अपवर्ड या डाउनवर्ड टिल्ट होगी, और दिस इज ड्यू टू दी लीडिंग टू कंपनसेटरी चेंजेस इन द स्पाइन। बिकॉज आपकी जो पेल्विक टिल्ट होगी उसकी वजह से आपको स्पाइन पे भी चेंजेस होंगे बिकॉज ऑफ द पेल्विक टिल्ट। इन द अपर एक्सट्रीमिटी you may see the abduction or subluxation of shoulder because of the muscle weakness, and the flexor deformity of elbow. This you can see in the upper extremity of the poliomyelitis. This is all for the today. Thank you so much. Please remember to like, subscribe and share this video. Thank you all of you.